Well, let's give people the playbook now. Let's talk about specifics. Somebody that has, say, depression, autoimmune disease. We can, throw at any chronic disease, and they want to get practical.
Hmm.
And they now have some of the pieces: insulin, blood glucose. They need to fix the mitochondria. But what does that look like? And how long does it take?
Yeah, wow, that sounds really daunting, right? Especially if you're sick. Like, no, this sounds awful. I'm clicking off. Like, don't click off. It really isn't that hard. Like the sciencey stuff to me was, oh, when I first heard about the ketogenic diet, I actually was like, oh, great, another fad diet that I have to explain to patients is a fraud. And then my ability to find the fraudulent part of it took a lot of my time because I was sure I was right, but I was wrong. And so the sciencey stuff is for those people that need to say there's evidence behind what we're doing. But let me tell you the practical parts is that this, it never felt so good. The first thing I do when somebody's saying, I really want to do this is I start with, I know it's a little cheesy, but it is, well, there's a reason every self-help book starts with this, and that is revisiting what is your motivation? What is your why? And, I've done this enough times that I've put in a workbook. What are the steps I do with patients? What are the steps I've learned from really good psychotherapists or psychiatry teams that said it's not a lot of steps, but there are 3 really important questions that when you ask these, patients learn what's their measuring tool, and can you find the heart of what motivates them. And so I get them into a really genuine why. I lead this class twice a year, which is a live 21 days. It's a very intense class that, and the first day of class, I revisit my why. At the end of the month, I start the 6th class, and I'm excited because not only is it the best medicine I've done in 25 years, but I get to reassess my journey too. And the first day I start with, what is my why? Why do I keep doing this? I could do a million other things with my life, but what motivates me? And that genuine connection to the reason you do something, you know this. Your story's had some setbacks and then some successes, and then setbacks and successes, like all of us. And when you're in those moments where the setback comes, if you can't remember what the heck was I doing this for, like a really honest discussion between you and your God, why are you doing this? You're going to fail. So we talk about that why. We make people write it down. I do not let them get away with cheap things like, I want to reverse my diabetes. Like, that is a lie. Yes, you might want to do that, but that's not genuine enough. So we talk about that root of knowing what's your motivation and writing it down and having that in a place of focus for your life. But the second thing we do is we do not begin yet. I have people count carbohydrates before we begin. I am an internist. I first want not to hurt you. And there are people in what I call the 200 club. They have more than 200 carbs a day on average. And that's going to hurt when you go keto. So I have them get out a chronometer app. It's a free app online, but it's the most accurate for tracking carbohydrates. And I go through this in the workbook as well, just saying, look, you just do not begin ass over apricot. Do not do this without knowing a couple of things. If you've got more than 200 carbohydrates a day, I'm going to want to step you through this. You're going to want to cut down for a week, and then we're going to start. So what's usually, it's classic, is they just do not realize how much their food is filled with carbohydrates. And I don't play that net game. This is a total carb game. We are looking for success. If you want to play around with a ketogenic diet, there's lots of other people you can follow. But if you're looking for I take care of the folks who've got severe problems, and I want them to see this is the rules I use. If you had cancer, if you had seizures, if you have autoimmune disorders, you've got to follow some of these rules if you want the reversal of the disease. It's not a secret, but it is difficult. So that first week, how many carbs are you taking? And if it's 200, cut it down to 100 for the first week before we start, or at least for 3 days. The second thing I do is I have them clean out their cupboard. As soon as they realize how many carbs they're eating, the cupboards get emptied, and I have them post a picture of what their pantry looks like. Because if there's a bunch of processed carbs left in your cupboard, this is an addiction. And if I were helping you with alcoholism, I would not condone you working at the bar at night. You're too close to the drug that has consumed you. Those processed carbohydrates are going to feel really good. And that demon of what insulin has become in their mind, boy, it's more powerful than any word I can come up with. So having that carbohydrate too close is danger, danger, danger. So we clean out the cupboards before you start. But once the cupboards are cleaned out, I say, all right, tonight at supper you begin, and I have them go out to eat because I don't want them going grocery store. I don't want them filling the cupboard yet. I want them going out to eat. Maybe they can have a couple of eggs in the refrigerator, but they go out to eat and they have they have chicken wings that are little bitty chicken wings, not the chicken nuggets. These are chicken wings and they don't have breading on them, but most people like chicken. I mean, even if you look across all spectrums, chicken's pretty easy for folks to like. You can have a rub on there. We don't want you having a lot of sauces, and you can dip it in the real ranch dressings and real ranch or real blue cheese. We want you having fat and protein. I point out to the casual listener that the key about that first meal is that we want them eating the skin, and we want them eating the tendons, and we want them eating the gross part of that, not just the chicken breast, because it is in those, the parts, the whole animal that we really do have, your body will have an attraction for that. And I need your palate to start to develop in what is that, what is this? How do we transform you to like these foods? Well, you must begin. So let's begin with one that's pretty dang easy, buffalo wings. I want you eating as much as you can. No soda pop, no beer. Have water with your supper. And that is, you're going to eat till you're full. And then you're going to go home and go to bed. Go home, don't add food, go to bed early, get up the next morning, and we want you having eggs for breakfast. So a couple of them, 2 or 3. I don't care. Have a half dozen. I don't care. As many eggs as makes you feel full in the morning. Frying them in some good fat would be great, but I don't get lost in the details. Just have eggs. If you're driving to work and you're looking for something, McDonald's, great idea to get a sausage patty with their egg McMuffin, hold the bun. They do that now, and that's not that uncommon. Welcome to the world of, serving the patient, right? So that starts out how they eat. The first day, I go through a few more menu things. Again, not really setting menus for people. We want you developing a palate. We know that when you put out menus, there's an instant snub of, I don't like that, and I don't like that. We are redeveloping how you taste food. So please journey, having an open mind enough to get through those first few days. And I don't have them count anything but carbs. What they're doing is looking at a urine ketone strip for the first couple of weeks, saying, I would love it if you pee ketones by 48 hours. That is a sign your metabolism is, well, they're all rescuable, but you're going to be on the much easier path if you make ketones within 48 hours. In many of my patients, I mean, they give up carbs for 10 days and they don't make ketones. And it is just such a signal to me that this insulin's got a hold on their heart, their brain, their endocrine system, and we have a lot of work to do. And we go through what we do in those situations, but the first few steps are they get to eat as many hours of the day as they want, as many times in the day as they want for the first 2 weeks. And what naturally happens is their body becomes, their insulin lowers, first of all. That's the most beautiful thing. If you are looking at the studies on this, that 48-hour, that ketone arrival means the insulin went down. You cannot produce ketones unless the insulin goes down. Now, the caveat is, if I've got one of those really sick patients, and praise God they made ketones, their insulin may still be 10 times as high as mine, but it is about 30% lower than what it was doing. And that's enough to awaken this other path of your body saying, oh, snap, we need this other fuel. And arrive on the scene, the beautiful little ketones, and usually people can feel it. They feel an energy like they haven't felt it. And it's usually the first thing they feel is their brain. In fact, when my girlfriends, I'm 53, and when mom's babies all go off to college, or menopause hits earlier than they wanted, or whatever happens to their brain, that they come to me and say, they call me Annette, I'm depressed. Will you write me a prescription? And I said, it's really tough for me to do this. I love you. I want you to feel better. I'll write you that prescription for Prozac, but I don't want you to fill it for 10 days. And Jesse, I'll have them just drink exogenous ketones for 10 days and then read the book. Because the ketone arrival, just like that first wave of ketones, comes to the patient, and the reversal of depression is so profound. It's embarrassing that I took care of brains for as long as I did without using this tool. because it is such a universal power of awakening a brain that's been muted. It's been in that zone that just cannot feel life outside that zone. And the arrival of ketones, you can tell by the way they talk to you. First of all, they have a little more facial expression than they did the last time. And they have energy, like, wow, this is what you're talking about? Not everybody gets that. My severely insulin resistant patients don't get to feel that. They have to do a couple other things before that wave of ketones hits them. But it really is the signal that the chemistry inside their body is starting to change. You have fat hormones, vitamin D, testosterone, estrogen in your body that's trying to get to its target organ. One of those target organs is your brain. And when it can't get there, it can't do the job. Why would it not get there? Because the dictator of fat, which is insulin, and all of these hormones are fatty hormones. They are ruled by insulin. So those high levels of insulin prevented the testosterone from getting to where it needed to. Estrogen, vitamin D, cortisol, all of those things are muted when the insulin is high. As soon as that starts to drop and ketones begin to flow, the other thing that's flowing is the fat-based hormones. Those surges of GLP-1, GIP, these drugs on the market that are woefully popular because they are answering a signal that has not been answered for 50 years in some people. And its delivery changes the course of how their life will go. It is that profound when these hormones show up, which is why these other drugs are so successful. When I see that happen in a patient, we call that fat adaptation. And usually the signal I wait for, and I try not to tell people the cliff notes on this because they'll say, but I skipped a meal. Because a true sign of the resurrection of these hormones is they accidentally miss a meal. People who have never missed a meal in 40 years say, what the heck, I missed lunch. And that is normal. Your body should be able to go 12 hours without eating and not feel the craving. You should be able to focus through a project and say, oh, snap, I just missed lunch. And when that happens, don't go eat because you have to. Listen to your body. It's doing a job. You're giving those mitochondria a workout. You're making new mitochondria that don't have the little holes in it. And that's the beauty of what I think medicine in the next generation is going to be filled with. It's not in Western medicine by training yet, but it will not be able to avoid it with the incredible success that we are seeing in research, in practice, and hopefully now in policy that says, let's shift the rules so that our patients can see health quicker, faster, and with a more sound basis in the science.
All right, so we're going to make the dietary shift, lower the carbs. Eventually, insulin's going to come down. And with that, we're going to start making ketones. You talked about the new hormones that we're going to be making. The part I'd like to hear more about is the broken mitochondria. And just because we're now making ketones, which are a new fuel for our mitochondria, most likely, does it take a period of time before they become adapted to that fuel? Obviously, they're broken, so they need to create new ones or repair. But how good in the beginning is our body at using that new fuel, ketones?
Yeah, so that's what takes the first couple of days before they feel better. Maybe probably about 4 days before they really feel the improvement. It is where this Dr. Boz ratio comes into play, is that people want to measure it, and I really support that. They don't. Okay, let's put it this way: my people want to measure it. The people who follow me, and maybe it's too many engineering brains that like this, but you can see the failure coming. It doesn't show up like one day. It just doesn't work. You can see the body resetting. So you're right. This first wave is easy. We call it, they make a tsunami of ketones. They do great. And then their body starts to adapt. The first week, maybe a few new mitochondria are made because it's such a dramatic shift. The shock of a new chemistry set will cause mitophagy, production of fresh mitochondria. It really is the highest surge of those mitochondria being replaced, we think, happens in the drop in the blood sugar, actually. That first arrival of ketones sparks a you know, that organelle of the mitochondria implodes. So apoptosis of the organelle, and it gets replaced with a fresh mitochondria. So that's when that happens. But then you can see people not do any of that mitochondria replacement because they hang out in a zone where the blood sugar is better, but the ketones, they hit a wave and then they crash. Their body just adjusts. And what's truly happening in the background is they had so much insulin to begin with. Yes, we lowered it by a third, and that was such a good relative improvement. And then the body reset, and then there's still plenty of glucose, and there's still a lot of insulin. So now those ketones are back at zero. So now they need to reset again. And then they need to reset again. So that word keto continuum did not come out of my, creative brain. It came because, another patient stalled. Why are they stalling? And what they would teach me by saying, oh, look, here's what we're going to have to do to get this going again. I want you to do this for 3 days, come back in 3 days and show me what happened. And as I learned, that's what a severely insulin resistant patient does is they push the reset button way faster, meaning that insulin drops and their ability to replace the mitochondria slows to zero. So you can say the ability for a mitochondria to be replaced is autophagy. That's this word where you say, well, how do you measure autophagy? And the answer is only researchers have the ability to measure it. We have the ability to approximate it. We do know that it's a shift in when the cell is flipping back and forth to glucose and ketones, your body will always want to go to glucose. Don't worry, it doesn't need any help with that. What it needs help with is seeing ketones often enough and being reminded that's what it is, and then doing the metabolic work to see it flip back and forth. So when we look at the Dr. Bos ratio, which is a glucose divided by ketones, and if I can get their Dr. Bos ratio to be less than 100, they're usually all losing weight, even my insulin-resistant patients. But if I want them to be repairing mitochondria, I got to get their Dr. Bos ratio to hit 40 at least 4 or 5 times a week. So I'm looking at a morning fasting number of 40. That is very difficult to get in these insulin-resistant patients without just knowing the rules of how do you do that. And that's what that process, when they just think they're chasing a number, they lose focus. Like, okay, so I don't hit as good a doctor ratio as you. Who cares? The reason you care is that's how you take out the trash. That's how you undo the dementia coming your way. That's how the mitochondria get replaced. And I think this is that core spirit of how do you help patients really have the gift of health. And that means you teach them well enough to say, this is what you're searching for. This is why you need to do it scientifically. Know emotionally why you need to do it. And then best way for you to do this is not alone. Be in a group, be in a partner, have a support group of your own, have a family member do this with you. Because in the isolation, the devil talks too loud. It's just easy to say yes to a carbohydrate that you didn't mean to, but you do now. And it's a very predictable pattern that when they stall, if they can phone a friend, the time off the way, falling off the wagon, time off the path of improvement is shorter. And we work a lot with that in our company. This community needs to be alive with small groups, helping one another.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
If I had to put one demon out there for the chronic diseases that have filled my internal medicine clinic for 20 years, insulin wins. You can say, Doc, I want to check a fasting insulin. And we have lots of people do that. But the fasting insulin is